Do you think that President Trump is being judged fairly?
No, actually, that's an unfair question because you're asking me to pass judgment on the press's treating of the President of the United States.
It may be unfair, but numerous times you've commented and criticized or contradicted what the president says. So do you think he's being judged fairly?
Well, it depends on what you mean. I work in the White House, and I believe that everyone there is doing everything they possibly can to do what they need to do.
So, Dr. Fauci, you said as late, and I got a newspaper article that as late as March 31st, there was no consensus on wearing masks. And the president, as you know, relies on your expertise. Do you now regret not advising people more forcefully to wear masks earlier?
Okay, we're going to play that game. Let me explain to you what happened back then.
Should be a yes or a no.
No, there's more than a yes or no by the tone of your question. I don't regret that because let me explain to you what happened. At that time, there was a paucity of equipment that our healthcare providers needed, who put themselves daily in harm's way of taking care of people who are ill. We did not want to divert masks and PPE away from them to be used by the people.
Okay.
Now that we have enough, we recommend.
I've got two more questions, so thank you for that, Dr. Fauci.
With me now live from the Hill is CNN senior congressional correspondent Manu Raju. Manu, I wonder what stood out to you, and I certainly, that tone from Dr. Fauci answering that question from a Republican congressman, I mean, he clearly was feeling like he was taking some blame for something that he should not be taking blame for as he was trying to save the lives of frontline responders.
Certainly defending his approach and the early approach by this administration as we look back about what happened and whether or not more could have been done. One of the things that has stuck out in this hearing is how different the tone has been from these public health experts about the concerns that they have about this disease continuing to spread in this country, much different than what we're hearing from the president and the vice president. The vice president, of course, said last week that there will be no second wave. The president has essentially suggested that testing is overrated, is essentially as a double-edged sword in his view. He believes that that's the reason why there are more cases. Well, Anthony Fauci says the reason why there are more cases is because, in his view, there's a disturbing surge in more infections happening in the United States. He said it's been a mixed bag how things have been dealt with, and all four witnesses are making it very clear that more testing is needed in the United States. Now, one of the big things going into this, of course, was the president's comment from Saturday, the Tulsa rally, in which he said he suggested to staff to slow down testing for COVID-19. But when asked today, the four witnesses indicated they have not been asked by the president to slow things down.
I know for sure, but to my knowledge, none of us have ever been told to slow down on testing. That just is a fact. In fact, we will be doing more testing.
Of course, the president's staff afterwards, after he made that comment, said that he was only joking. They spent the last 2 days saying that. Then this morning, the president said he doesn't kid around when he was asked specifically if he was joking about that remark. But the person who's in charge of testing for this administration, Admiral Brent Giroir, testified that more testing is needed. He said the only way that we'll be able to understand this disease and who is infected and who can pass it is to do the appropriate contact tracing, as well as to test as many people as possible. So that is the message. They want to test 40 to 50 million people per month by the fall. This far, we've only had 27 million tests that have happened in the United States up to this point. So a dramatic push needed by this administration that is being voiced by the administration officials that states need to undertake and needs to happen in order to safely reopen, much different than what we're hearing from the president. Brianna.
Certainly is. Manu, thank you for that report from the Hill. President Trump has just landed in Arizona today, that's where he's going to be holding a number of events. And it's happening in a state where coronavirus cases are just surging. After making a stop at the border wall, he heads to Phoenix to address thousands of young supporters inside of a church. No masks required for that event, which the mayor says violates safety rules against large gatherings. All of this happening in a state that is quickly becoming a hotspot for the coronavirus outbreak. Today, setting a new single-day record with more than 3,500 new cases and 42 deaths. Before leaving for Arizona, President Trump insisting he was serious when he said he asked his administration to slow down coronavirus testing. Of course, this contradicts claims from his top advisors who say the president was just joking.
It was a comment that he made in jest. It's a comment that he made in passing.
You know, it was tongue-in-cheek. Come on now. That was tongue-in-cheek. Please.
I don't know that it was. I don't know that it was tongue-in-cheek at all.
I know it was
tongue-in-cheek. He has said similar
that's
things
news for you.
months.
Tongue-in-cheek.
He has said similar things for months.
It was clearly, I understand that there's not much of a sense of humor at CNN Center, but the president was joking. I'm not surprised that you're either unable or unwilling to understand that the president had a tongue-in-cheek remark there.
I don't kid. Let me just tell you. Let me make it clear.
CNN's Jim Acosta is traveling with the president in Arizona. And yesterday, Jim, the administration said he was joking. Today, he says he's serious. Also today, his top health officials are saying they haven't been asked to slow testing. Set this straight for us, because heads are spinning trying to figure this out.
Yeah. I'm not sure we have enough time to set it straight, Brianna, but you're right. This has been tying the president and his top advisors into knots over the last couple of days. We can tell you that the president just arrived here in Yuma, Arizona. He's going to be making a trip out to the border in just a short time from now to go check on the progress of his border wall that's being built along the border of the U.S. and Mexico. Kayleigh McEnany, the White House press secretary, was just asked about this during a gaggle on Air Force One. She is trying to clean up the president's cleanup of his comments from Saturday. And she said just a few moments ago that when the president said earlier today, I don't kid, he was trying to make a serious point, she says, about the importance of testing. And so those are the latest comments coming from the White House press secretary. But as Mana was just laying out, and as you just laid out a few moments ago, they are essentially in cleanup mode right now. They're in damage control mode right now because, as the president said on Saturday, he instructed officials inside the administration to slow down testing. In the aftermath of that comment, which has been turned into political ads already by the president's adversaries, we've seen the White House press secretary say the president was just saying that in jest. We saw Peter Navarro, the trade advisor, saying the president was saying that tongue-in-cheek, and then the president comes out this morning on the South Lawn of the White House and says, I don't kid. Now, one thing we should point out, Brianna, is that the president and his top aides have used this kidding excuse in the past. When the president said, I am the chosen one, back in 2019, he later tweeted that he was just kidding about that. When the president suggested that Americans inject themselves with disinfectant to warn off the coronavirus, he said the next day that he was just being sarcastic about that. And so when the president says this morning on the South Lawn of the White House, I don't kid, he's obviously not telling the truth. He's lying there because he has used that excuse in the past. That is, of course, Brianna, whether that depends on whether those statements that he made in the past were falsehoods when he was saying he was kidding about recent, and past controversial comments. The other thing we should point out is as the president heads out to the border wall later on this afternoon, he's going to be checking on a border wall that only amounts to about 200 miles of border wall that has been constructed during the Trump administration. It is in most cases replacing existing wall or augmenting wall or border fencing that was already in case. There's really only been a few miles of actual new wall that has been built during the Trump administration. And so we'll hear from the president in just a short while from now while he meets with border authorities, and we'll have more on that as it develops, Brianna.
All right, Jim, in Yuma, thank you. Joining me now is Dr. James Phillips, physician and assistant professor at George Washington University Hospital. He's also a CNN medical analyst. Doctor, thanks for being with us. Always good to see you. You said you heard the president say he's serious, that he wants the U.S. to slow down testing. Yes, there seems to be a little cleanup at the White House, but he says it wasn't a joke when he talked about it. What's your reaction to that?
I want a clear answer as a citizen, as a constituent. as someone the president works for, I would like to know the truth, that if he did say that, to whom did he say it? 4 people have said it wasn't them, but there are others, Secretary Azar, some other folks that maybe he was referring to. And if he's going to say something so idiotic and so contrary to the things that we've been working so hard to do, I think that we deserve answers as citizens. As a doctor, it's just absolutely alarming.
Yeah, because what would it mean to slow testing with the goal of, affecting numbers and trying to make it look like there are less cases? What would the goal be there?
Yeah, this isn't the first time that this administration has made comments that make it clear to the public that they believe that lower numbers are better for them politically. And I don't understand that. I think that the strength that they could be showing is in wanting to get more testing, preventing more disease. The 2 fronts that we use as physicians and my partners in infection control are to test so that we can know who has the disease, but even more importantly is infection prevention measures, which is simply wearing a mask and washing your hands and staying away from other people. And unfortunately, the president and his leadership style, he just doesn't want any of that to be something that we abide by.